Hi, Laura DiGiulio, registered massage therapist and NKT practitioner. I'm here at the beautiful Coastal Sports and Wellness in Bedford, Nova Scotia. I'm going to show you a pattern that I've seen over the last couple days in several of my clients. The complaint typically is lots of stiffness and pain through the neck and the shoulders, and people are pointing kind of to the base of the neck and the shoulder area. And what I've found with these people is that the muscle at the back of the neck and shoulder, called levator scap, responsible for turning your head, is overworking for inhibited sternocleidomastoids, or SCM. SCM is that muscle that's sticking out the side of my neck here when I turn my head. They can commonly be inhibited related to the levator scap. And so in this pattern, people get lots of dysfunction and pain because a muscle is overworking for another muscle that's not doing its job, essentially. And so I'm going to show you how to change that. The relationship here is that the left levator scap turns your head to the left. But as you can see, the right SCM turns my head to the left. Opposite happens on the other side. So on the other side, my right SCM turns my right levator scap turns my head to the right, and my left SCM also turns my head to the right. So they act as pairs. They act as synergists for each other. And so if your levator scaps are overactive, this is how you're going to correct that. So you're going to take a therapy ball. This one is by Trigger Point Therapy. Great company, has lots of wonderful products. You can buy their products at tptherapy.com, or you can use a lacrosse ball or a tennis ball. So here I'm going to put this therapy ball between me and a wall. So I'm going to place this ball kind of at the top of my shoulder blade, between my shoulder blade and my spine. And I'm going to find a sensitive spot. And I'm going to just lean back into that sensitive spot and kind of rock back and forth. And all I'm trying to do is really soften up that muscle. If you're treating your right levator scap, you can also do this release by turning the head to the left and dropping the chin. And coming back to neutral, turning the head to the left, dropping the chin. That will stretch that muscle, and that's a fine release as well. You can do both the therapy ball and that stretch. You want to spend about a minute or two doing that release. Immediately after you do that, you're going to activate the SCM that's inhibited. So in this case, I release my right levator scap. Immediately after that, I'm going to lie on my back on a bed or on the floor. You're going to turn your head to the right. Here's that SCM that's inactive. And then you're going to lift your head off the table about an inch or so and drop. Lift your head and drop. Do that as many times as you can without creating pain or cramping, without holding your breath. If that's 2 times, then that's fine, or if that's 8 times, that's great. What you want to do is make sure that that movement is honest and that you're not creating compensation anywhere else. You would do the exact opposite for the left levator scap. If you're not sure whether or not that correction is specifically designed for you, get assessed by an NKT practitioner. Very easy assessment and can individualize corrective exercises for you.